scapula, this is how we expect to see it. In all likelihood, you're going to be asked to do it on the table. You can do it upright, but you'll likely be asked to do it on the table, depending upon what combination we decide that you're going to do. For us, we put together things that makes the flow faster, all right? You know, getting up off the table, up here, getting back and down, you know, that sort of thing. So, now, if you want to lose at least 2 points, okay, put her arm over her head like this. Okay, so what did she just do, other than obviously what she did? She caused her scapula to rotate like this, and now it's a blight. All right? So we just don't do that. All right? Sounds like a simple little maneuver, creates problems when you do it. Okay? Now the lateral, just raise this leg. Okay? Look that way, please, ma'am. I want you to bring your arm over just for a moment, and we're going to get her to roll up towards her left side. That's good. That's good. Okay. We're going to put her in a light position to look at the lateral, to look at the scapula in the lateral position. Okay? So her scapula sits like this in the AP. And we're going to keep rotating her body until we rotate it like so. All right? Now her body, same thing about the arm. Her body is clearly a blight, but when I look at her scapula like so, this is the axillary border, that's the vertebral border. And what this tells me is I need to turn her up just a little more until I get both of those sitting on top, both of those borders sitting on top of each other. So when you start doing this, let's pick someone who is about her build, and she'll have an easy scapula to palpate. Okay? So this stays an inch or maybe an inch and a half below the inferior ankle, and so we don't worry about where the top is. If we have the bottom, we have the top. Rarely will you see a scapula that's much larger than my hand. So that ought to fit rather well on a 10 by 12, don't you think? Right. And then we just center the central ray to the transverse portion of the cassette itself. All right? Once again, if I bring the arm over like so, then the proximal aspect of her scapula is now covered by her humerus. So we have to look through the humerus to see the proximal aspect of her scapula. If we just leave the arm in this extended position, then that's not a problem. So there's a reason why you manipulate this arm. Now, follow this for as many scapulas as folks will allow you to do. If it's a comminuted type fracture of the scapula, you're going to have trouble doing some of this. Okay. But if it's a follow-up scapula, you won't. All right. If the fractures are relatively minor, you won't have any trouble doing it. So if you're looking at the inferior angle like so, the higher up from the scapula that fracture is placed, the more difficult it is for you to be able to manipulate this arm the way you want to, right? So we're not going to see any patients as a group like that now, all right? Next semester, we'll see some patients like that, and then we'll move into Plan B, but not today, all right? Okay. If you'll lay on your back, please. Now, in both of those cassette was placed longitudinally, all right? So now we're going to do a clavicle, is it?
Mm-hmm.
Yes, sir.
Good. All right, so the film goes in transversely. If I'm going to x-ray the right side, I'm going to put an R here, all right? Now, when you approach a shoulder for just either an AP internal or external rotation, where does the cassette go? In other words, where do you center? That's the thing.
Cocoid process.
The coracoid process. Has everybody felt a coracoid process yet? Have you?
Yeah.
Okay, I really don't want you messing with that coracoid process. So, listen, if I take this cassette and I put it an inch above her shoulder, that's all I had to do. I don't have to palpate anything, all right?
Okay.
Right. And then all I've got to do is to center this center A to the cassette, all right? Now, we're looking at this from the standpoint of a clavicle. So her clavicle, this is called the extremity end of her clavicle, and that's the sternal end. So the question is, where do we put the longitudinal ray? Well, let's find her manubrium, okay? And let's just look at the lateral aspect of her humerus, and let's put this center ray between those two areas, all right? So we've got this manubrium, this humerus, and we're putting the center ray right between the two,
Can
okay?
you turn this way so I can?
Just like that, okay? Manubrium, shoulder, the midpoint, whatever that is, between these two, okay? And so all the anatomy that you're gonna see, really for a shoulder or clavicle is gonna be there. So that's exactly what I'm doing. So what I'm saying, the first projection for our clavicle is just about the same thing as it is for a shoulder. The only difference is I'm going to try to put the transverse ray more in line with where her clavicle lies, which means that in this case, instead of it being an inch above her shoulder, it might be 2 inches. Okay.
So you want to
Remember
put it
the
on the
clav-
clavicle?
Hmm?
You want to put it on the clavicle?
Yeah, in that range. See, the clavicle runs like this. It doesn't run like that, it's like this, all right? So, a couple of inches above the shoulder, it's gonna be there, all right? So, we're going to change our collimation, whoops, to this, all right? Does this longitudinal ray appear to be about halfway between these 2 points?
Mm-hmm.
Okay, so I know I have both ends of the clavicle on there, and that's what we're trying to look at, all right? So then, we're gonna take this and bring it down somewhat.
Did you just collimate it to a
10 by 12.
10 by 12?
I did. Would you like me to collimate less?
I was just-
I don't know if we just asked. So I'm gonna angle this 15 to 20 degrees cephalic, all right? I'm going to find the inferior surface of her clavicle. Okay, this is the superior surface, that's the inferior surface, all right? It really doesn't make any difference. We can either put the central ray entering where my thumb is, or we can put it on top of the clavicle. The difference is the thickness of my thumb. We can have a big, old, fat 10 by 12 here, okay? It's like shooting ducks or something, fish in a pond, that's the expression, right? We're going to center longitudinally the same way we did it a moment ago, right? Okay. And then we're going to put the center ray, the cassette centered to the center ray. And we're done. One thing about clavicles, never put the arm over the head. When you put the arm over the head, the clavicle sits like this, you cause it to rotate on its axis a bit, so it distorts when the arm is above the head. It's already a distorted looking bone anyway. It just becomes more so, all right? So we'll keep the arms down. Sometimes you'll become so accustomed to x-raying infants for chest x-rays, and you're always gonna put or place their arms above their heads, because that's the same thing as rolling the shoulders forward. So when an infant comes in and it's for a clavicle, we have to stop and think. We're not worried about where the scapula is on this. We only want the clavicle. Keep the arms down by their side. The techniques for these two will be just about the same as the technique for a shoulder, which is, for this lady, is going to be somewhere between 15 and 20 mass and 70 kV. Okay? The most difficult one is the scapula lateral. So practice that one. And remember this stuff about, we just don't put the arm here in an arbitrary fashion, right? If I'm grading your test, I'm going to be looking to see that you're hunting for that inferior angle and that you place the arm here, because that's the point at which the scapula moves away as much as it's going to move away, all right? Interpret it, you know, with women by and large, you'll find that their movement doesn't change much, where with men you'll find that with the movement of the arm it does. That has more to do with the musculature and its tautness, right? Doesn't make any difference. Some people, the arm is going to be here. Some people, it's going to be here. Okay, for this young lady, it's right there. All right. Okay. All righty.